everyone, I'm Tamanna Inamdar. Welcome to a brand new episode of Step into the Future, presented by GE and partnered by the Times Network. Now, today we're talking about the paradox that is Indian healthcare. On the one hand, we have obviously some of the best doctors in the world, some of the best medical facilities in the world, and it's no surprise that we are such an attractive destination for medical tourism. But on the other hand, the access to healthcare is not something every Indian enjoys. Once you go out of the big cities, you move into smaller towns and smaller cities, the access to healthcare does deteriorate. Now, there are a number of reasons for this, number of factors for this, and one of the reasons that people talk about is how much we spend on healthcare. The aim is to increase the amount of the budget that we spend on healthcare to 2.5% of GDP, but in the interim, it is the private sector in large parts which is burdening the shoulder. Today on the show, we are focusing on General Electric. GE over the last 120 years has played a pivotal role in the manufacture of medical devices in India. And we're talking about how innovation combined with a digital India can help bring these services to a larger set of citizens. To speak on this, I'm joined today by Dr. Shravan Subramanyam, Managing Director, Wipro GE Healthcare. I'm speaking with Gautam Khanna, CEO, PD Hinduja Hospitals. And I'm also going to be speaking with Dr. Rakesh Verma, Chief Cardiologist, National Heart Institute. Welcome to all of you, and thank you so much for speaking with us today on the Times Network. Mr. Subramanyam, let me begin with your take on the point we raised on the National Medical Devices Policy of 2022. When we're talking about accessible and affordable healthcare, how do you see this policy helping?
Tamanna, thank you so much for bringing up this topic. You know, healthcare has been top of mind for everybody the last couple of years, and medical devices have played a very critical role in dealing with the pandemic and, of course, healthcare overall over the last few years. This has to be taken in context of the overall ecosystem. You know, about 5 years ago, we had the National Health Policy, which laid out some of the priorities of the government. And alongside that, we had a fantastic insurance scheme also that tried to ensure access. As you mentioned earlier, access to healthcare is one of the critical areas that we are all working on. And along with that, we have the National Digital Health Mission, and then it follows quite naturally that we have also the National Medical Device Policy, which is able to support the aspirations of delivering affordable care, accessible care for the patients. And you mentioned it yourself. India is a bit of a paradox. We have a healthcare system, some of the best, finest centers in the world, and there are some places just a few tens or hundreds of kilometers outside the cities where they don't have access to healthcare, and it's also quite disparate between different geographies within the country. So having this National Medical Device Policy gives us that opportunity to ensure that we have the products and technologies and services that are best suited for our Indian population, for our patients, for our communities. Couple of aspects that they're looking into. One is, of course, how do we create an ecosystem that allows for local manufacturing of the appropriate products that are needed for our market, right? Along that, how do we do that? We have to look at research infrastructure, we have to look at collaboration, we have to look at investment mechanisms, and very importantly, we also need to look at skill building, because we can't have some of these latest technologies available in the market unless we have the right trained technologists and doctors who are able to use them with our patients. So this is part of an overall journey towards making healthcare more accessible, and I think the National Medical Device Policy has a very pivotal role to play in this, Tamanna.
You know, you spoke about the role that all of these medical devices have and how important it is to use them, especially in outside the big cities. I want to bring in Mr. Gautam Khanna for some perspective on this. And Mr. Khanna, you run an amazing, well equipped hospital in a large city. But when you go outside the large cities, you have this resistance of sorts to not only the use of these medical devices, but maybe from the patient's end as well. The challenges could be cost, it could be accessibility. Can you give us a sense of where those hiccups lie?
Thank you, Tamanna, and I heard Shravan's comments very well said. You know, outside the large cities, the challenge of access, affordability, and quality you had mentioned earlier in your opening remarks. You know, access is, of course, access to the physical infrastructure. It is also access to a doctor. It is access to an information. So none of these are easily available. In terms of quality, again, the quality is what they have available locally. I'm not saying it is bad, but they are limited by what is available there. And affordability is a concept which has to be understood in a different context in India, like you mentioned, that affordability should be looked at in terms of capacity to pay. Somebody who can pay, for a Mercedes versus somebody who can pay for a small car, for them the affordability is a different criteria for each of them. So similarly for healthcare, when we say affordability, we need to look at which segment of the population we are talking about. Now, in the context of the question which you have raised, we are talking about, the tier 2 and outside the large cities. But let me give you a perspective on these things. One of the things which, for example, the government has been doing, and government is cognizant of this fact, that there is a shortage of doctors and shortage of nurses, shortage of allied health professionals. So there has been a concerted effort to increase the number of doctors. For example, new medical colleges have been sanctioned. The regulations have been changed to allow medical colleges to come up a little more easily, less regulation, and they have been mandated to increase the DNB, the postgraduate seats. So currently we have almost 83,000 postgraduates, but now 83,000 graduates. But to get post-graduation seats, the government is working with all the private institutions and medical colleges to make it simpler and to get more PG seats. But all these efforts will give results only after 5 to 10 years. But the shortage is now. So to look at it, the only way we can do it, in my view, is by use of technology. And now by technology, what I mean is on two aspects. One is we look at the data aspect, which is the access to information. And second is the delivery, which I'm talking about access to healthcare, health services. So when you look at access to delivery, we saw in the pandemic how teleconsultation took off. The e-consultation, the video consultation took off really well. So now suddenly people sitting in far off cities can access doctors in any large city. To give you a perspective, for our Mumbai hospital, we had patients calling us from 250 cities in the country and 10 cities from outside India. It's impossible to do without technology.
Dr. Rakesh Verma, let me take that point to you. When we talk about accessibility and affordability outside the big metros or outside the big cities of India, is it a question of lack of access? Is it because people can't afford it? Or are patients hesitant as well to use new diagnostic tools?
See, in last couple of years, the government is focusing not only on the quantity of the healthcare delivery, but also on quality. While several state governments and central government have announced and are practically implementing that, each and every district of this country, whether in north or in south, east or west or central India, each district will have at least one medical college. As you and I both are aware, the moment a hospital gives a treatment, it is quality treatment and satisfactory treatment. But if a medical college runs through it, the teachers who teach, the teachers who treat, the students who follow and implement, the quality is substantially better. So now we have got almost 20 All India Institute of Medical Sciences, be it Guwahati, could it be Bhubaneswar, be it Madurai, be it Kerala, be it Bilaspur in Himachal, and 2 AIIMS in Jammu and Kashmir, to name a very few. Even Patna has got All India Institute of Medical Sciences, Bhopal has got All India Medical Sciences. So government has not only set up a benchmark for itself, in quantity, because now more than one. Instead of one, we have got about 20 All India Institute of Medical Sciences, and quality. Once we label an institution right from beginning, they're not hospital converted into AIIMS. They're right from the beginning, right from the concept, they are AIIMS. So they have to maintain a degree of level of excellence. They have to maintain a degree of outstanding healthcare. They have to imbibe the local talent, local infrastructure, local disease in their curriculum. So your question, it seems, I think, is satisfied that government is working very hard on quality and quantity, considering the wide length and breadth of this unique country which is known as India. We're having a population of about 140 crores. So one AIIMS for less. Similarly, the inception, when the country became independent, we had only about 20 medical colleges. Today, the number of recognized medical colleges is more than 450. So that makes also a huge difference. Once you're in medical college, the quality of treatment, the discussion, academic discussion, research discussion is far, far better. So I assure you, on both the counts, that is quality and quantity, government is fully alert, fully aware of its responsibility and is discharging also for the last man standing in the queue.
This is a good time to ask Dr. Subramanyam where exactly GE Healthcare can come in this scenario, because there are several aspects we've talked about when we refer to non-metros. One is accessibility, affordability, but also the basic amenities, electric connection or consistent electricity connections, water supplies, internet connections. How do you go around all of these challenges to make sure that every Indian, the last Indian, also has access to affordable healthcare?
Perfect, Tamna. I think that's a good question, and one of the challenges that we're trying to breach in medical technology. But we now have the benefit of so many new technologies that may not have been available earlier, which can help us breach this gap, right? Eventually, using, say, for example, 5G technology, we'll be able to get information across much quicker. Gautam spoke about getting information across, right? Getting information across to patients and making sure that they are aware of their surroundings and their healthcare attributes. I believe an informed patient is an empowered patient, and our goal is to ensure that every patient, no matter where, has access to their medical information, medical data, and they're able to use it with their clinician and hospital where they can make informed decisions. Now, how are we going to go about doing that? In India, at our technology center at GE, we are working on several new technologies or adapting existing technologies to make them more robust, more reliable, even in a remote setting. Take the example of our recently released CT scan, which is much lighter and consumes much less electricity than a conventional CT scan. That makes it, more, I'd say, agile, if you will, to be utilized in locations where it may not have been possible to do so earlier. And this comes from a lot of R&D processes and testing and collaboration and working with systems to see how these can work. And we've had a lot of successes now doing that.
You know, it's no secret that in India it is the private sector that is shouldering most of the burden of medical infrastructure available to Indians. What do you think can be done further in this area, Dr. Rakesh, in terms of private-public partnership?
There is a dearth of funds human resources, technical resources was there. There were certain situations where government felt that the situation may not be totally conducive for the government itself to alone take up that challenge. In those situations, certain public sector undertaking, certain private organizations, certain philanthropic organizations, certain NGOs wanted to contribute. See, if a project has got, say, 100 quantum, private organization may not be able to meet all 100. Government may be able to provide 80%, 90%, but not the full complete. So this acted as a symbiosis, and this resulted in very good result. Certain NGOs had manpower, dedicated, devoted technical manpower, who wanted to do something. I should not be naming, but if you allow me to say, like Lions Club, Rotary Club, other philanthropic organizations who have got highly trained, skilled technocrats, but they can't devote all the time to construct a hospital, to run the finances of the hospital, but they are ready to do ICE work, public awareness they are ready to do. They are ready to provide once in a week or twice in a week their expertise as a management guru, as a financial guru, as a logistic person, as a HR persons, where government wanted some contribution from them. And those kind of models have acted very well in large aspect. I would not say they have acted perfect in all nooks and corners and all situations. To very large extent they have worked very, very well. And I hope the citizens of this vast country are aware of their own duties and responsibilities simultaneous to their rights for healthcare.
Just a closing comment here from Dr. Subramanyam, because we've spoken on so many aspects of affordable healthcare, what GE is doing, but there is one more point I think I was keen to touch upon with you, which is the kind of investments you're looking at, because India is positioning itself as a global manufacturing hub. There are new schemes, including the production-linked incentive schemes. How bullish are you on some of these initiatives?
Yeah. So Tamanna, this is a very important question because medical technology is changing so rapidly that you need to constantly invest to stay with or ahead of the curve. And it's not just medical devices alone. You're looking at pharmaceuticals, you're looking at so many other areas where you're investing into healthcare. So this investment will be constant, and upgrades and better technology is a very important part of ensuring better clinical outcomes. With that context, we have just constructed our 4th factory here in Bangalore to deliver accessible products, more affordable products. And we have utilized the production-linked incentive that the government announced a year and a half or so ago. We've invested about 100 crores in this facility, Tamanna. We've had an advanced entry-level CT scan that we have manufactured from this site. And we'll be doing a lot more based on the needs of the community, of the medical community, and the priorities that were written out by the government. We are bringing in, catheterization lab products, cath labs, as we call them. We're bringing monitoring products for the intensive care unit, ultrasound, high-end CT scan. So we're bringing in a lot of technology that may not have otherwise been easily accessible or to manufacture in India through the production-linked incentive scheme over the next several months. So this is an exciting phase. We're seeing a lot of uptake, a lot of traction. A lot of again, as Gautam mentioned, we need trust, right? We need to learn to work with each other and take advantage of each other's expertise and experience, because without the skill and the capabilities offered by institutes such as Gautam's, these products would not be utilized and patients would not benefit from them. How do we take them further beyond centers like, in Mumbai and some of the larger cities? We need to continue to invest in education, skill building, Now, the government, as part of other related schemes, has also announced several new medical colleges, All India institutes, the NIPER program, for pharmaceutical education and research. So all of these are coming together. Education also at a level of technicians and technologists who are operating these instruments and servicing, repairing them. All of these need to go hand in hand, because I could very easily put a 128 slice CT scan machine in a tier 3 city, but it would be pointless if there's no operator to use it. So Tamanna, all of these go hand in hand, and this is what we are working on. Indeed, a very exciting time to be in healthcare, in medical technology. Thank you, and back to you.
Well, I want to thank all of you for your time and for speaking in such detail about a subject that impacts millions of Indians. It's amazing to see how innovation and the great Indian Jugaad can really help change people's lives. Thank you for joining us on this episode of Step into the Future.